are improving the lives of the most vulnerable populations in greater Cincinnati by equipping individuals with the knowledge, the tools to be a part of creating their own health solutions. Only 20% of our health is the delivery of care and quality of care. The other 80% is about where we work, live, and play. The overall lives of individuals are going to be impacted so that we are all thriving and successful in our communities.
Closing the Health Gap has taken the initiative to have programs right in the community. So we've opened our church up to be in collaboration with Closing the Health Gap, and we have a lot of local things going on. I have changed some things that I used to do as a result of being part of this program. But when I started keeping a food diary, and that was one of the things that we were encouraged to do with the Health Gap, and I started watching what I was eating. And I said, oh my goodness, and I turned the pages, so I've got to change this. It's impacted me personally. I can't speak to it enough.
I wasn't the overweight guy that wasn't eating right and all that, but it exposed me to some new habits, some new ideas. Anybody look at me, they say, well, he looks pretty much in shape, okay? But how did I do that? I did that by doing what these people are encouraging everybody to do. You've done shed 10 to 20 pounds, well, where did it go? You just changed your eating. You got you moving. I didn't know I could do that. You did it.
I never thought I would want to just volunteer. I actually love going to different neighborhoods, telling them about what I do for the Health Gap, talking to help programs about eating properly. But until I got into this program and realized there was so many things that I was missing out on that I could be a part of, they opened up a door for me that I thought was closed. I love being in the community.
One thing I love about the Health Gap is we in the community. As health coach, we're in the community. It's different than the person behind the desk. If I get myself adapted with all the tools that I need to teach them about how to eat better, to lower the diabetes rates, to lower the blood pressure rate, and embrace them and show them about more fruits, how important fruits and vegetables are, because it's each one teach one. The tools that I learned, I will eventually one day teach someone else, and it will continue to grow on and grow on.
Our program, there are basically three components. One is during the school day, in the after-school program, and we also have the produce market program in our building. I think the biggest obstacles is having access to those healthy choices. We could push this all day and teach students healthy eating habits, teach families healthy eating habits, but if they don't have access to that food, it makes it a lot more difficult. I think that's a very big challenge for our families.
When I talked to people at the Center for Closing the Health Gap, and they told me they wanted to do some things among the churches, basically healthy eating classes, check blood pressure, sugar levels, and the whole 9 yards. So we invited them into the church. They gave classes, eating classes, cooking classes. I think we initially had about 30 members, involved. Most middle-aged folk and even some seniors. Once they begin to get happy about themselves again and comfortable with doing things, their energy level and how they looked and how they felt, then all of a sudden they begin to participate in a lot of other things. They became happier people, really.
My relationship with the Health Gap started several years ago when they started the Healthy Corner Initiative. That initiative wanted to address the food deserts that we currently have in several communities, including Avondale. The fact that we're even able to offer snacks that would be of a fruit variety is a big plus for us. When I think of just the organization itself, it cared enough to go out and say, you Avondale, you Walnut Hills, you Evanston, you over the Rhine, you West End. It's important that you have healthy foods, choices that you can disseminate to your community. That made it important to me.
Hospitals and healthcare providers are driven by reimbursement strategies. And unfortunately, the reimbursement strategies in the United States historically have focused on sickness care. So you only get reimbursed if an individual becomes sick. So the Center for Closing the Health Gap was an innovative approach to working with health centers whose main mission was prevention and early intervention, but to take it a step further into individual responsibility.
UC Health has had a long relationship and a rich relationship with closing the health gap. It dates back for many years. As one of the healthcare providers, we've actually been a long-time partner and financial partner of closing the health gap. The thing I most appreciate about what they do is they really are a community-based organization that works with the community. We take a lead in healthcare, they take a lead in health, and this is a great marriage and why we think it's so valuable moving forward.
I've seen enormous change in the populations that we serve, and because of that, it continues to inspire me every day to keep pushing because we can see the impact that we're having on people. We've got people talking about health who never talked about health. We got people exercising who never moved. We got people who are talking about eating fresh vegetables and fruits that have never happened before. The hospitals, the city council, and others have had the confidence in us to do the work that we've been doing. So we want to continue to push.